Hi, welcome to this month's Chat with Nurse Linda. I am Julie Lubinsky. I am the Associate Director for our digital team here at Christopher Dana Reeve Foundation. And I'd like to tell you just a little bit about Linda before we begin. She has been a leader and a provider of rehabilitation nursing for over 30 years and a friend of the Christopher and Dana Reeve Foundation for close to 20. She is also the moderator in our online community, Ask a Nurse discussion, where she focuses on contributing functional advice, providing a how-to on integrating various healthcare improvements into daily life, and answering your questions. And once a month, we're very lucky to have her live answering your questions on this hour-long web chat. So now I'd like to turn over to Linda. Hi, Linda.
Hello, and hi, Julie. Hi, everyone, and welcome to the web chat for today. It's so nice to have you here with us, and we've got a lot of questions in the chat box already, so we'll try to get to as many of those as possible. I did want to start out with just a little bit of opening about the blog that's been occurring through this month. It's been the focus of the blog has been on conditions that people get even though they have a spinal cord injury. It's the things that everybody gets, diseases and processes that our bodies go through that we're all susceptible to. And sometimes I talk to individuals who have spinal cord injury, which I do all the time, but people will say to me, "Oh, wait a minute, I had a gallbladder attack. That's not really right because, I have a spinal cord injury." And sometimes people forget that you have that, but you're still susceptible to all the things that everybody else is susceptible to. So it doesn't quite seem fair, but it is the way that it works. So the reality of life is such as it is. But sometimes it's kind of difficult to tease out some of those problems because the symptoms are maybe vague, or if you have difficulty with sensation or recognizing sensation in parts of your body, it might be more of a challenge. There are some things that can help you and help your healthcare professional deal and diagnose some of these issues. So we all know about people who have heart attacks, and sometimes they have this pain that goes down their left arm, or they'll have pain in their left shoulder, or pain in their jaw, usually on the left side of their body. And so I think you're picking up the theme here on the left side of the body. The same kind of thing can happen to individuals who have spinal cord injury that maybe don't feel the lower parts of their body. So if you have the heart attack, if you have a gallbladder attack, if you have an appendicitis, if you even have a bowel obstruction, or sometimes even a urinary tract infection, you might pick up on the fact that you're having this because sometimes people will have this referred pain usually to the left shoulder blade. It's kind of the same as with a heart attack, but you're not having a heart attack. You might be having something else. And that is because at the T10 level, at the thoracic level at T10, inside the spinal cord, there's a little place where a whole bundle of nerves are run through the spinal cord very, very close together. And so sometimes messages from the lower part of the body that are trying to travel up to the brain get kind of tangled up in this little web of nerves, and the way that the pain gets referred then is in the shoulder blade pain. So if you have sudden onset of shoulder blade pain, if it's going on, if it's progressing, if it's lasting over some period of time, you certainly want to talk to your healthcare professional about that, because there's probably something going on in your body someplace that your body's trying to tell you, we've got a problem here. The brain's not picking it up because of the spinal cord injury blockage, but something's going on in your body. So be sure and be aware of that. Now, we all know what muscular pain feels like, and when you're overworking your muscles, or you're holding your body up using the muscles that are available to you, sometimes you can get muscle pain. So It's a little bit different feeling than that. It may feel like a muscular pain, but as you get to know your body, if there's a change or a sudden onset, then you really want to look at for some kind of clue as to what's going on there. Other things that you might want to think about is just looking at your body, how it reacts to situations, any kind of change in body habits. I posted some information from the American Cancer Society. If you have any change in any part of your body by visually looking at it, skin cancer, change in a wart or mole, any unusual bleeding, any kind of change in bowel habits over like 2 or 3 months. So, any of the normal signs of looking for cancer, you should be aware of in your own body just as well. Now, you'll notice that all of those signs and symptoms are very, very vague, and they seem to match up with other things that are secondary complications with spinal cord injury. So, it never hurts to let your healthcare professional know what's going on, let them have a look, maybe do a test if necessary, kind of clear the decks and make sure that it is what you think it is and not something more serious. The other thing that I spoke about in this month's blog was the higher incidence of bladder cancer in individuals with spinal cord injury. That is something that has been noticed in research and in healthcare for quite some time, in that people who have spinal cord injury have a much higher risk of developing bladder cancer than the average general population. So does that mean that you will get bladder cancer? Certainly not. It does not mean that you will get that, but it's still something to be aware of, that you do have a little bit higher risk, so you want to be more vigilant about that, and you want to control factors that you can control. So if you have a risk factor for bladder cancer that cannot be controlled, such as being a male. Males have more bladder cancer than females. That's just in the general population. It's, just one of those things. Age is another thing. As you get older, people who get older have more risk. Well, we're all going to get older. We can't control that. The other thing might be something like a genetic predisposition. So if bladder cancer runs in your family, you need to be more aware of those kinds of things. There's nothing we can do about those factors, but there are things that affect bladder cancer that you can do something about. Now, most people know that if you smoke, that you have a higher risk of lung cancer. And smoking and lung cancer kind of go hand in hand. So if you're smoking, you have a much greater risk of lung cancer. We all know that. But what most people don't know is the number 2 cancer that develops from smoking. Number 1 cancer would be lung cancer. The number 2 risk factor in smoking is bladder cancer. So if you have a spinal cord injury, you have it. It's like aging. It's like your gender. It's like a predisposition. So you have a higher risk. So you don't want to add to that by being smoking and therefore make your risk even greater. So cutting down on smoking, watching what you eat, watching the fluids that you take in. Sodas, especially the diet sodas, have been linked somewhat to cancer. It's a very, very vague kind of link. But I know, being a person who loved their Diet Coke for so long, especially the Diet Colas seem to have a higher association with kidney malfunction and perhaps even a greater association with bladder cancer. So having to give up that, I know how difficult that is, but you might want to think about that, giving up diet colas. Now, it seems that the white sodas like Diet 7-Up, Diet Sprite, those don't seem to have the effect that the Diet Cola does. So just a little tidbit of information, but, trying to take care of yourself and reducing your risk factors as in the things that you can control is important. Another thing is watching your catheter technique, so making sure that you're using plenty of lubricant, that you're catheterizing on time. One of the big risk factors that was identified with all individuals who use catheters, whether you have a spinal cord injury or not, was the use of latex in products. So catheters used to come just standard. They were latex catheters, latex in gloves, lots of latex in healthcare equipment. And so a lot of that has been removed. You can still buy latex products, but what will come up first are the non-latex. So non-latex gloves, non-latex containing catheters containing latex. So that's readily available. You know, when they first switched, it's kind of ironic because when they took the latex out, the price went up for everything. Now it's kind of even if it's latex or non-latex, but be sure your products all say non-latex so that you reduce that risk factor for yourself. So when they took the latex out of all this equipment, they thought, oh, well, now the risk of bladder cancer and the development of bladder cancer will go down. Well, shockingly, it didn't go down that much. So that was kind of surprising because everybody pinpointed latex as the culprit, and by golly, when it was removed, the effect, the incidence did not significantly drop. So that was kind of surprising. So people are still looking for exactly what that link is, but it seems like using good hygiene, using the non-latex catheters, lubricating your catheter very well before using it, moving more. So even if your body can't move, if you can passively move your body. And now there is a theory that perhaps, so nobody knows why there is this link with cancer in the bladder after spinal cord injury, but now they're thinking, well, maybe it's just the fact of having the spinal cord injury and the development of the neurogenic bladder. Perhaps that is what the cause of it is. So really paying attention to your catheter schedule. There's some thought that perhaps the bladder being overstretched is maybe, because people delay catheterizing, that might be a factor. So just paying attention to the times when you need to void, to empty your bladder, paying attention to your technique. There's a thought that maybe it's not lubricating the catheter enough. So just, paying attention and being vigilant, and then cutting out all those things that we do, those bad habits such as smoking or drinking a lot of sugary drinks, full-on sugar sodas or sports drinks, being sure and check your water that you're drinking. A lot of people like the flavored waters, which are actually very good, but look and see how much sugar is contained in those, or if it's not sugar, if it's aspartame or saccharin, what's being processed in through your water. So be sure and check all those kinds of things. If you live in the city, probably your water is being checked frequently by the water department. If you're living out in rural areas and you have well water, you might want to ask the water department to check your well, which they will do at no cost to you. You might have to wait until you get on their schedule. Sometimes people live in rural areas where there's not individual wells, but they still have well water for like the whole city. And so sometimes in rural areas, they might be checking that water by county or by region. So your well might be not. They might be checking the water frequently, but your particular well where your water comes might not be checked as often. So you can call the water department, ask when your well water was last checked, and ask them if they could check it again just to make sure that your water is safe. We've had a lot of news about the Flint, Michigan water crisis, which had lead in the water. So it's just a good idea to make sure that, we go to our tap, we expect that we're going to have fresh water come out of there. but it's just a good idea to be sure and check. So let's go to the questions today and see. We've got a lot of questions. Let's see what's up with that. And our first question follows right in with this whole idea. Is a person who's having frequent UTIs and extreme burning, even when they have a negative culture. And so this sometimes happens. It could be that maybe the bacteria that could be in the urine could be just missed in the culture, but it sounds like that's not the case in this particular situation. But really frequent UTIs. So how can you help reduce your chance of UTIs is to drink more, again, fresh water. So keeping the system flushed out, you always want to keep the system going from what you put into your mouth. You want to keep it flowing out. So if you can increase the amount of water that you're drinking, look at the type of fluids that you're drinking. If you are drinking, again, those sugary fluids, that tends to breed more bacteria. Bacteria, that sugar is just food for the bacteria, so they love that, and you don't want a UTI, so drop all those kind of drinks. Think about teas and coffee, how much tea and coffee with the caffeine that you might be ingesting. And again, just using the fresh water to keep that system flushing out. If you can increase your fluids, you don't want to just go out and start, I'm going to increase my fluids, so I'm going to drink an extra gallon of water today. You don't want to do that. You want to increase your fluids, especially water, just a little bit. Start out trying to drink an extra cup. That's not very much. Just try an extra cup a day and see if that will help you. If you have cardiac problems, you don't want to overwhelm your heart by increasing too frequently, too fast. But just take a little bit extra water. Try a cup for a week, an extra cup a day for a week or two, and then try a little bit more. Now, we have that rule of 8 ounces of water a day. It's a pretty good rule. It helps people kind of get in mind how much they should be striving for. Most people don't really drink that much water a day. The better rule of thumb is to drink when you're thirsty, but a lot of people don't recognize when they're thirsty because they are not having the movement or the expenditure of energy, and that's for everyone. It's for people who are sitting at desk, who are not moving around a lot. They don't feel that thirsty that much. So if you can drink a little bit of water every day, a little bit extra, and then if you want to, you can, I know several people have tried this method to increase their fluid, is that they estimate, they'll write down when they drink, what they're drinking, so they get an idea of what they're taking in. Then they'll put that amount of fluid, maybe of water, into a pitcher. So they'll start that in the morning, and they know by the end of the day they have to drink their whole pitcher, and then maybe they'll add a little bit to that. So sometimes we think we're drinking a lot of fluid when we're not really drinking that much at all. But people get into their routine, they get into their habit, they have so much at breakfast, and then maybe a little break in the afternoon, and in the mid-morning they'll have a little more fluid, and then so much at lunch. That really helps you with timing with your bladder program as well, so your bladder doesn't get that overstretched, so that you're sure that you've got what's going in is coming out. So that might be a big help to you. I know that there's a question that's going to be coming up further down about prophylaxis for the bladder to help prevent urinary tract infections. So drinking is certainly one thing, drinking fresh water, making sure that you're getting enough so you have that the fluid going through your system. And then the other thing, too, with these frequent UTIs, it seems that the way that urinary tract infections occur is that you get some bacteria that enters your bladder, either through your body or maybe through the catheterization process. So again, using very good technique, washing your hands very thoroughly. If you're in your own environment, you probably do not need to use a sterile catheter system. Usually people get adjusted to the bacteria in their normal living environment, but washing your hands really thoroughly and for a fair amount of time, either say the ABCs while you're washing your hands or sing happy birthday to yourself 2 times, not just 1 time, but 2 times. And then you know you've washed your hands, and lather up, get lots of soap. Work around the fingernails. That's where a lot of bacteria likes to hide. Think of your hand as having 4 surfaces. It has a top, the bottom, and each finger has a side, 2 sides to it. So really washing your hands. Now, if you have so many UTIs within a certain period of time, generally your payer will boost you up to sterile catheter kit. So, or not a touchless catheter kit. So, different payers have different rates of the number of documented UTIs. Not when you think maybe you've had a UTI, but documented. So you have to have the culture and sensitivity to document that you had the UTI and so many within a certain time frame, within a certain amount of months. And then you can request from your payer a different catheterization system. But for most people, that's usually using clean technique will help. The other thing is that once you've got the bacteria in your bladder, it can stick to the side of your bladder, and that's where it likes to multiply. Or it can be floating around in the urine in your bladder, and you get a couple of bacteria, they stick together, and then they start really just getting more and more. They start multiplying. So being sure that you're flushing that out, being sure that you're not feeding it with any kind of sugary drinks, and then also moving. So when we walk around, our abdominal muscles contract and relax, and it kind of shakes the bladder up a little bit, which keeps the bacteria from adhering to the bladder wall, keeps the bacteria from sticking together. I kind of think of it as a James Bond process. It's shaken but not stirred. You know, your bladder's kind of being disrupted, the urine in your bladder. It's moving around because you're moving around. So when you're sitting and not able to move around, that takes away that kind of natural protection for keeping the bladder the bacteria broken up. So what can you do? You can do passive range of motion, having either picking up your legs and moving them around. You can move yourself within your seat where you are, either by using the adjustment device on your electronic wheelchair to lay yourself back, sit yourself up. You can do wheelchair push-ups, which will help elevate your body and move your bladder around. You can drape yourself carefully over the side of the wheelchair. If you have enough balance and support, you can lean forward. You don't want to topple out of your wheelchair, so be very careful before you do that. So all these kind of things, any kind of movement that you can get in your body, in your lower abdomen, will be helpful. Even passive movement. If somebody moves your legs for you, perfect. That's going to help stimulate that bladder into moving around. So all those things are important. When you turn in bed, that's going to move your bladder and move your urine around. So, you know, just kind of like you'll be surprised when you're doing your activities if you think about it. Oh, yeah, I can see where I'm kind of shaking my bladder up a little bit. That's very helpful for that. Okay, so the next question is a little bit different. This is somebody who has syringomyelia and had surgery, and so now they've got some problem in their thigh muscle. that's having some trouble. So what is syringomyelia? Well, sometimes people will call it a syrinx for short. So what happens is that within the spinal column, when you have a spinal cord injury, you might have a bone that presses up against the spine, or you might have some overstretching of those nerves in the spinal cord. But when damage occurs, it's interesting because the damage will occur from the center of the cord out. So it goes from the inside of the cord out, even though something hit it from the outside of the cord. It's that inside that has the trouble. And so there's a little fluid collection that will be in there, and sometimes that fluid collection grows and it puts pressure on the rest of the nerves above and below where you had your spinal cord injury. So it doesn't happen very often, but if you find that you're having some decreased function, you will notice it above the level of your spinal cord injury. So if you find you're losing some function that you have, you might have a syringomyelia. You'll have to have testing done to have it diagnosed. And then if you need to have surgery, the fluid collection in the center is getting bigger. And so what surgery does is they go in and they drain the fluid out so that usually most people will have some return of function. So why isn't the muscle returning in the thigh? Well, it could be that when they go in to drain the syrinx, they have to go through the spinal cord nerves. So there's no way that you can do that without creating a little micro abrasion to the spinal cord. And it could be that one of those nerves was maybe affected in some way during the surgery, or it could be that as that fluid pouch grew, that maybe there was a lot of fluid that was pressing on the particular nerves that were going to the leg, and so the syrinx could have created more damage. So how can you get that leg straightened? Well, therapy would help, and if you have a higher level injury, you can try some of the electrical stimulation to help build that muscle. Now, if you have a lower level injury, generally speaking, those muscles will not stimulate electronically. So people who have the higher level injuries, they're the ones who have more the hyperreflexic nerves, so their nerves are their muscles are more spastic. They have more a spastic bladder, spastic bowel. Things are more hyperactive. And if you have a lower level injury, then things are more flaccid. So you'll have a flaccid bladder, a flaccid bowel, and more flaccid muscle tone. So it makes it, the treatments are a little bit different depending on where the level of injury is. But using some therapy might help make that right leg strengthen. It might take a matter of time for everything to process and get through. And then sometimes there are changes that just take a bit longer to correct themselves. But your body, your nervous system wants to correct itself. It's really trying to. Everybody's nervous system is constantly trying to improve and regenerate itself. So your body is trying to make this happen. The process that we need to do as people is to encourage that as much as possible with therapeutic treatment. Range of motion being the very most basic. With that input, stimulation, if it can't be provided from our brain, using other parts of our bodies like our arms to move that leg, and then using other kinds of therapeutic modalities through swimming or partial weight supported walking or functional electrical stimulation or other therapy treatments. So you want to get with your healthcare professional and create a care plan for strengthening that leg muscle. Okay, here's a great question because a lot of people always have questions about sexual function. And the question is, will I ever be able to have an erection again? And if no, can you give me some other information? Well, again, thinking about the people who have higher level injuries actually have erections, but that are male, but they're not really functional. So they might have an erection, but they can't sustain it, or it doesn't last long enough. The lower level injured people generally, again, have that flaccid, so they will not have erections in an automatic function. However, there's a lot of things that you can do to help with sexual function. Now, there's a difference between having an erection and having an orgasm. So some people talk about an erection meaning the whole process of erection and orgasm. Some people are just talking about the erection themselves. They're two separate processes that work together. So there's a lot of different things for males to help with sexual function. There are medications that you can take. There's Viagra. However, with most spinal cord injuries, not all, but for some, people will try the Cialis, and it seems to have a better result. It depends, again, on what level of your injury it is and what the source of your spinal cord injury is. So, but there's a whole conglomerate of medications for erections for males. Now, for females, there's not that number of medication type advantages. Lubrication is a problem with females, and generally they use a lubricant. So actually the females have been kind of, the research for female sexual function is quite a bit behind what the male function has come up with in the research. It's kind of unfair, but that's, I think it's because the process is so much more complicated in the female body. But anyway, so you've got medications for erections. If that does not work, there are injections that you can do right into the penis itself, which will provide an erection for you. So some people have a hard time giving themselves an injection into the penis, and so but some people use that, especially with lower level injuries, and they find that quite satisfactory. There's another process. There's vacuums that you can use, which will provide an erection by drawing extra blood flow into the penis that will help accommodate the sexual process, sexual penetration. And then if you still are having problems, implants can be done. Those are kind of interesting process. So in some they have implants that are put into the penis, and then once the implant is in there, you just have a constant erection. It can be disguised in your clothes, so it's not like, it's not like an odd-looking kind of thing when you're out in the community, but a lot of people find that very satisfactory for them. There are also more complicated implants where a bulb syringe is also implanted either in the abdomen or sometimes in the scrotum, so you can pump up the implant or release it depending on when you want to use the implant. So there, it goes from some very basic medication kind of things, even some injections, or even substances not going throughout your body, like using the vacuum to obtain more blood flow, and to very elaborate kinds of very serious, more surgical kinds of interventions. There is information about sexual function on the Christopher and Dana Reeve webpage in the information sheets, I believe. And so there's a lot of information that's out there about that because so many people are really, really interested in that. Again, for erections is one thing. To achieve an erection is not that really all that complicated as far as all the devices and medications and everything that's available. Having an orgasm is quite a bit different. Now, we do know physiologically that having an orgasm is a lot related to mental function. So a lot of people will use visualization. They pick up with the mood and the sounds that their partner's making. You can kind of retrain your brain to have what they call a psychogenic erection or orgasm, where your brain will stimulate that just with thoughts, the orgasm phase of the sexual process. So that's a little more complicated to do. It takes a lot more effort. There's also different positions that you can use. There's different techniques you can use. So some people, if they don't have sensation in their genitalia, but maybe they have sensation in their under armpits, sometimes people will use some sexual function and gain orgasms by using that extra skin in the armpit area. So there's a whole lot to that, but there is a lot that's available to you on finding out. There's some excellent books about training yourself to do that. There's also some therapists that can help you do that. It's probably a lot more complicated than our little webinar today, but many individuals with spinal cord injury have used the psychogenic orgasms or use alternative parts of the body for sexual function and find it a very satisfactory way of dealing with that situation. Okay, so the next question is a person who has myelomalacia, and so they can walk to a limited scale, but have such an amount of pain which is associated with that condition, and they think that their families become somewhat numb to their condition. Do you have some material that can explain this? Well, yes, there's a lot of information that's available about this particular condition on the Internet, and I'm not quite sure, I'm not quite sure in the question if your family's asking you to do more than you're able to do, or if you're just finding that they're not maybe sympathetic to your cause. When people have chronic illnesses or chronic diseases, or they have trauma and their life has changed, sometimes it's difficult for people to keep going with the accommodations for years and years and years. So I know even in dealing with my own personal life, sometimes you have some big life changes with yourself or within your family. And at first people are very, very sympathetic. They're wanting to help you. They're really trying to accommodate you a lot, and it's just wonderful. Not that you have the condition, but the support that you get is so wonderful. And then after a while, people kind of tend to fade away. They don't want to be a part of their whole lives. It's a part of your life, and there's just no way that you can get away from it. There's nothing you can do about it. It's just the way that it is. But sometimes people get kind of weary of the chronicity of the problem. And so I'm not quite sure, but if there's a lot of information that's available on handout sheets about the condition, and you can give that to your family members. I think probably the important thing is to think, okay, I've got this, I need some help, be very specific. Would you mind getting this for me so I don't have to get up and, walk over and get something, and sitting down and talking to your family and saying, these are the things that I really need help with, and being very, very specific about that so that they know what they should be doing and what they shouldn't be doing. Sometimes people think, well, I wouldn't normally help somebody with that, but I know that you need help with this. And so they will do that, but you need to be very specific with them. And sometimes, it just doesn't enter into people's mind if you think, would you get me a glass of water because, it's just so difficult for me to walk over there and get a glass of water. You don't need to explain it to them every time, but just let them know that you might need help with some task. A lot of times when you're with family people or when you're with friends, they don't think to offer to get up and get you a glass of water because that just doesn't pass through their mind because they don't have the same issues that you have. So I think I think you've got a great idea of looking for some information that will help explain what it is that you have and explain your needs. And then if you be very specific with them about what your needs are so that they can help and just, so it becomes just a part of your natural interaction instead of every time, I have to explain my condition to you. It just becomes a part of the way that you interact together. So you don't need to review it every single time. But I think you're off to a great start to get some information, let your family know about the condition, what you're going through, and especially if you get the information from an accredited source so that they can see, this is not something that, you've just kind of designed or you're using it to your advantage or something, but that they see, oh yes, people who have this disease have these particular needs, and so, or this condition. So this would be a really good start, and that's a great way. And then being very specific about what kinds of things you need. I need help to the bathroom. I need help fixing my meals. I can do these things on my own. Sometimes people are afraid to be too overzealous in helping, thinking that they're offending you when you're sitting there thinking, please give me a break, So, being very specific will also help. Here's a person who's been going to a wound care. They have a pressure sore since October, and the wound is just staying the same, and they're trying to get a wound vac. Would you recommend this, and how can I get faster healing? Well, first of all, I love the wound vac. I think they're just fabulous for people who need the wound vac. So if you have an open pressure sore, and the whole process with the wound vac is that it seals off the area, and then there's a very light pressure that's applied that keeps, again, that flowing out. It keeps the exudate and the extra sera that's flowing out of the wound. Just has this very light pressure, so it keeps it coming away from the body instead of laying there and developing an infection. So if you need a wound vac, not everybody who has a pressure sore needs a wound vac, but if you have a significant sore and it's been hanging around since October, that's going to be the things to get. Okay, is it the magic cure? Why, no, it's not. The only way to heal up a wound is to stay off of it. So if you have a pressure sore and you're sitting in your chair or you're laying on it in your bed and you're applying more pressure on the pressure injury, what's going to happen is that it's just going to stay broken down. Sometimes if it's a not too deep injury, sometimes they can get healed. But most of the time, but the only way to really heal it is to stay off of it. So this has been going on since October. Now, sometimes people think if they have special bed surface and they have a pressure-reducing cushion on their chair, that it's okay to be on it. But it's not, because every time you sit on it or lay on it, you're applying more pressure to it. We have one gentleman here who stayed off of his wound. It took him over 3 months to get healed. I know some people take a lot longer even than that of completely staying off of it. He is an advocate now for avoidance of pressure injuries. I wish we could bottle him up and just have him go around and talk to everybody, because he's just like, I never want to do that again. Because, just laying in bed. But he's doing much better, and he's a real advocate. And he's like, boy, I wish I would have known. But these equipment that you can sit on or lay on, they're good at reducing the pressure, and they're good at dispersing it so that you have more even pressure. Where your bones are, it's always going to be more pressure because you have that hard bone pressing against the surface. So you really need to do your pressure releases, and you really need to have a good pressure dispersing cushion. Some people think, oh, I'll just sit on a pillow because that's nice and soft, but a pillow just collapses underneath you and makes more pressure. So you have to have these specialty cushions, but once you have a pressure injury, the only way to heal it up is to absolutely stay off of it. So people will say, well, how can I do that? I have to go to work. I have family responsibilities. I have to be up and about. But actually, that's the only way that's going to do it. And if you hear this man that I'm referring to, he's just like, yeah, it was just horrible because I lost 3 months of my life. He had to take a leave of absence from work and then just lay, on his remaining sides and rotating to reduce the pressure. And so that's the way that he healed his up. But that is actually that's just the way that they heal. Now, the wound vac's very good because it will keep the wound clean. It does not, and the other thing is, it won't allow you, depending on where you put the vacuum hose part, it won't allow, you have to put that kind of to the side because you don't want that hard hose on your, even though it's made out of softer material, it still has some hardness to it. So you don't want that on the pressure itself, or you don't want the vacuum to make the pressure sore even worse. So being very careful with that. You can help your pressure sore by increasing your protein in your diet, but staying off of it is the key. Okay, so now let's see. The next one here is what are the typical recommendations for leg exercise therapy at home after SCI for patients? So usually what people will do at the bare minimum is to do their range of motion, either themselves or have somebody else do it, and then continue with whatever therapy you were doing in your rehabilitation setting. Now, most people have 2 weeks of therapy that they can obtain per year through their payer. And so if you use that for mobility training, you can get some new exercises, maybe update what you're doing so that you can continue to do things at home. And people do all kinds of different things at home. They'll make little gyms for themselves. They'll use TheraBands, so that's long strips of, I'm going to call it rubber, but it's not really rubber. It's kind of like this expandable plastic stuff. You can buy them right in the Walmart, some TheraBand. And so they can put that around their, hold one end of it, and then it's like a giant rubber band. Put one end of it around your foot and then use your hands to pull your legs up and down. So there's all kinds of different ways you can do some passive range of motion in your legs, or if you need to do the same in your arms. And so that's really the bare minimum. Now, some people will go through and do more kinds of exercise, so they might go to their local gym and talk to a specialist there. You always want to make sure that you're working with somebody, either your physical therapist, if you're going to a regular gym and using some of that equipment there. You want to make sure that you've talked to your physical therapist because you don't want to harm yourself in any way. Get medical clearance from your physician and or your surgeon if you've had any kind of surgical repair to your spinal cord, so that you know you're ready for some of the higher level exercises. if you have a therapy pool in your community or someplace that offers therapeutic swimming, that's an excellent way to get some exercise because the buoyancy of the water will help you be able to move your body more easily. And you might even discover that with the buoyancy of the water, you might be able to move some parts of your body where you can't move those parts of your body on land because you don't have that water keeping you upright. So there's all kinds of things that you can do. There's equipment that you can request through your payer if you can get in some of the advanced therapies. The prices for the advanced therapies are coming down. A lot of payers will not pay them because they cost so much. If you are interested in some of them, some people have gone to church groups or community organizations and asked for help. If you were injured on the job, sometimes your workman's comp will be able to get those for you. There's still an abundance of people who are not able to get some of the advanced therapy equipment in their home. Some people will be able to go, if they live close to a rehab center, to go use the equipment after hours, and there's a little fee that you pay, like you would be going to an exercise gym, but you're going to a therapy center where the equipment is more for you. So talk with your therapist and see what kinds of things you can do. But at a very, very minimum, be sure and do your range of motion in your lower extremities because it's going to help. It's going to help feed that information into the lower part of your body that's not getting that electrical stimulation from your brain. It is going to help you with, as we discussed, with your bladder, reducing your bladder infections. It is going to help you perhaps stimulate some muscles or get some movement in your abdominal muscles, which will help with your bowel program. It's going to reduce spasticity. It is one of the most overlooked things that people do. You know, I'll ask people, and are you doing your range of motion? And they look at me sometimes like I have four heads. Well, I don't need to do that now. Yes, it's very important to keep up with that because there's so many good effects. You're really stimulating that lower body, and so that's an excellent thing to do. Okay, the next question is about rehabilitation and how can it be encouraged. And certainly they've listed all the different things. Exercise. You also need rest for your body. We all need rest for our body. And good nutrition. It says independent of surgery, and I'm not quite sure what that would be for, because most people don't have surgery, certainly to stabilize their spine, but then after that there's not really a surgery, so I'm not sure about that. But what about kinesiology towards spinal cord injury recovery? Well, any kind of muscle movement I think is very important. So I think just like I said, starting out with the range of motion, moving your body as much as you can is always going to be important. I've been really into the study of the history of how people have recovered from neurological injury. And if you go way back in history, it always comes down to the movement. So if you think about the polio epidemic, it was movement that eventually was the key factor. And we know in spinal cord injury, again, it's movement. If you look at some of the other neurological conditions that people have, Parkinson's disease, people can move, but it's very difficult for them after a while to start walking around. But one of the things that they found has been very helpful is dancing, especially those kind of smooth movements of the ballroom dancing. And so that's been translated into therapies for not only people with Parkinson's disease, but people with Alzheimer's disease. just all kinds of multiple sclerosis, any kind of gentle movement of your body, of your joints, is always very, very helpful. So any kind of movement, I'm convinced, is the key. Also, if you think about when you're moving your body, if you think about your body moving, visualization is very important. Sometimes people don't quite see that mind-body connection, but it is there. So while you're moving, think about your body moving. So if you're moving your leg or somebody's moving your leg and they're moving your knee joint, think about your knee joint moving. We know that the brain remaps itself, and it will, again, the brain wants to heal. It's called plasticity. So the brain wants to take over when something can't work. Different parts of the brain will try to accommodate for that and kind of take on that workload. So the body very much wants to get better, but it's more difficult if you're just sitting. If you're actually moving your body parts, then what you're going to find, and thinking about your body parts as they're moving, what you're going to find is you're making those connections. Now, we won't know that that's happening unless you have a functional MRI, and none of us have one of those sitting in our closet. So we just have to go ahead and move as best we can and know that it's happening, even though we can't see it or maybe can't feel it on that particular day. So very important to have movement. The next one is a person who became septic from a UTI infection. And so septicemia is a very serious thing. Sometimes infections get into the bloodstream and then it goes throughout the whole body. It's very, very critical that we are aware of problems when if our infection becomes septic. So if you have a urinary tract infection, you're having continual fevers, you can't seem to kind of get on top of it with antibiotics, you need to talk to somebody about septicemia. It can come on you very, very quickly. So if you have a sudden change in your condition, you need to have people around you who are alert and aware of that. So this person actually had a septicemia, and so that now they have some pain from some stenosis in their spine, and so I'm thinking that's probably the neuropathic pain maybe. So what is stenosis? So that's when the space where the spinal cord goes through the bony structure, the vertebrae, and it gets too tight. And sometimes what happens is people can bend certain ways. You know, they can like lean forward, or they can press their back flat against a wall, and it will kind of relieve some of that pressure. Sometimes people have to have more serious treatment for that, which is surgery, but this person is looking to relieve some of the pain from their stenosis. So you could try some different positioning and see if that helps. You could try some therapy to see if that will help. Again, this is a lower level injury in the lumbar area, and so he's looking to regain some muscles. And what we know is in those lower level injuries where the body becomes flaccid, the muscles tend to become very, very small. They do not stimulate through electrical stimulation such as the higher level injuries do. So getting some therapy to help with movement and to decreasing the pain would be the first place to start. Sometimes just reducing, changing your position will help reduce that pain, or doing some exercises to kind of reduce some of that pressure in there. So one more question. We're at the top of the hour, but I know there's this next question is about a baclofen pump. and they're looking for help with the back pain. The baclofen pump, since the baclofen is through the pump is at such a high dosage, that might help the pain and it might just take care of the problem. So we're going to keep our fingers crossed for that. Any specific medicines that can be added to the pump? Well, just about any liquid medication can be put into the pump. So sometimes narcotics are put in there along with the baclofen, but that's going to be kind of an individual thing. You might not want to go with the narcotics. The thing about the baclofen pump is that the medications, the baclofen is bathed in the spinal canals, so some of it will travel through the bloodstream, but most of it's kept right there and it doesn't travel through the whole body, so you don't have those whole body effects like you do when you take an oral medication. Oral medication goes everywhere throughout your body. Once you swallow something, it can go everywhere and anywhere. So hopefully with the baclofen pump that will help. So we are at the top of the hour. I'm sorry I can't get to everybody's questions, but we certainly did reach a lot of information and connected to the bladder. So I think we've done a pretty good job today of pulling it together. So with that, I'll say thank you very much. And I hope.
Yes, thank you, Linda.
Yeah. So have a good day.
All right, thank you everyone for joining us. And this is being recorded and will be up on our YouTube site, and you can sign up for next month's Nurse Linda at the end of the week. Thanks so much. Bye.
Bye.